Good afternoon, everyone. My name is Kelly Jessamy, and um, I have about 19 years experience in the field um, of social services. I initially, fresh out of high school, my freshman year in college, started working in the field as a direct care associate for a rehabilitation center for um, adults who had mental health diagnoses. From there, I actually ended up working for that organization for close to 7 years, even after graduating college. I then transitioned to work in a more acute setting at a local hospital in their brain injury department. I worked with family members and the patients with one-on-one counseling and counseling, parent education, patient education, and some discharge planning around reintegration into the community. From there, I went to work at a large for a pretty large organization as their director of intellectual disabilities and behavioral health. This was one of my first experiences in leadership. I ended up getting my graduate degree in health administration at MBA. After a few years in that position, I decided to go back to school for a degree in social work. And my primary reason for that is because I decided that it's difficult to make business administrative decisions. Good afternoon, everyone. My name is Kelly Jessamy. I am currently a CEO for Oak Plains Academy in Clarksville, Tennessee. I initially got into the social service field as a direct care associate for a psychiatric rehabilitation facility during my undergraduate studies. So that was about 19 years ago. During that time, I really had a passion, and I still have a passion for providing quality clinical services. Throughout the course of my career, I kind of veered off from providing direct clinical care to more of an administrative role. And throughout my time as an administrator, I started to realize that there was a big gap between funding and regulatory practices and really providing quality clinical services. And there seemed to be a divide. The administrators, we seem to be more focused on census and the bottom line. And we really need to ensure that we're maintaining quality, especially in this field. The facility I currently am CEO at, we serve children from 5 to 17 who are diagnosed with primarily conduct disorder. We do have a neurotherapy program. We provide school special education services also, just so they don't miss their educational goals while they are at the facility. I have experience, I've worked in acute care settings. I've worked in more outpatient direct settings also. I have a variety of experiences, but my heart and passion has always been with youth and adolescents and providing care and services for them to kind of build that sense of resiliency through hard times. We also provide family therapy, which is like key to make sure that once the youth leaves our program, our facility, that they're reintegrated back into the community and with their family in a positive manner. My primary reason, I guess I covered it a little bit earlier in my recording, for actually continuing education is I want to make sure that I initially went back and got my MBA so I could do a solid job. In my mind, I felt I needed to know budgets. I needed to know, how to make sure that the regulatory practices, that we were in compliance, how to manage multiple departments at one time. I thought that would really make sure and ensure that I did a good quality job. Over time, I realized that a major part of my job and a major part of what I do is to ensure that we are providing a service that's new, a service that's a program that's solid and that makes sense, and that at the end of the day, it's something that people can walk away from and feel that they've gotten something from. I don't want to just fill beds as a CEO. I want to make sure that I'm changing lives. And that's why I actually decided to go back from my MSW, so that I don't forget my roots and don't forget why I got into this field in the first place. It may seem a little abnormal, but ultimately, I put my heart into what I do. And I do feel that this is a important thing to be educated in, and particularly because Widener has this program with a trauma focus. So my goal is to use that to also help to create a better program for my facility. Thank you.